Advocacy Project, FANA Panther by Nimisha, Katherine, Vinh, Elliot, and Liz.
Our 60-day action plan and timeline includes, from days 1 to 7, a research and strategy focus. Review relevant programs from other states that have implemented similar opt-out plans for patient care. Consult with experts, policy members, management, and stakeholders to identify potential changes. From days 8 to 20, garner support and conduct resource assessment and allocation. Conducting research on patient demographics and identifying knowledge gaps through a survey on the role of CRNAs, developing a document highlighting the benefits of CRNA independent practice, such as decreased costs and improved outcomes to educate patients and public and gain their support, determine the resources required for successful CRNA independent practice implementation, such as training programs. And lastly, develop plan for the allocation of resources and identifying potential funding resources.
Once we have done our research on days 21 to 30th, we're going to now focus on developing the advocacy strategy. So, based on the identification and the knowledge gaps of patients, we're going to create a document or a pamphlet that covers the knowledge gaps that were identified in the previous weeks on the role of the CRNA, that also highlights the impact and benefits on patient care so that patients and the public are aware and they're better knowledgeable on what it means to have a CRNA as an independent provider. We'll also plan strategies for engagement in press release, on local newsletters, magazine, have social media to raise awareness, promote, and generate public support so that people are able to access this information without just being at the office, but they can find it in their local newsletter, perhaps in the city magazines, and obviously, of course, on social media. After that, during the days of 31 to 40, then we're actually going to engage with the patients and the public based on the information from the previous weeks. We've already put information out on social media. So now it's time to actually do these meetings. So we're going to schedule meetings with the staff to present to public and patients with the actual informational material, make sure that the pamphlets are available at key locations. We're also going to schedule and implement the social media presence to raise awareness and promote public support. So, as to before, we were kind of strategizing as to what we were going to do. Now we're actually implementing those strategies. And we're making sure that everything we have has evidence based studies and expert testimonials to support the highlights on positive impact on patient care and the cost and access and all the benefits that it will provide to patients and the public. Now, as we approach the end of our 60-day action plan and timeline, on days 41 to 50, we're actually going to take everything we have done so far and we're going to focus on evaluating the public response. So, we're going to review any public response from patients or public engagement events, either through social media or maybe some advocacy, perhaps any opposition groups or organizations that may comment on that social media, or phone calls that we might get or receive back. We're also going to try to anticipate and address any arguments against independent CRNA practice and the impact on public health. So, we're going to develop some evidence based rebuttals to counter identify misconceptions and continue to engage in professional and respectful communication with opponents and any public that is still unsure and perhaps may just need some more information. And based on that, on days 51 to 60, we can actually monitor progress and evaluate outcomes and change as needed. So we're going to continuously track our engagement and participation into CRNA-led practice to see if it make a difference. Are more people opting to get care from CRNA as opposed to an anesthesiologist? We're going to continue to monitor the media presence and public sentiment and opinion to gauge the effectiveness of the implementation plan and efforts. We are, of course, going to continue evaluating the impact on patient care, access, cost, safety, and satisfaction. And we're going to continue to adjust strategies as needed. So, as we're getting feedback, as we're getting more people, we'll perhaps conduct some surveys of the people that decided to make the change and feel comfortable joining CRNA-led practice. Maybe get some information from them, what they wish they would have known, what probably led for them to make that decision.
Fact sheet, public comment Fact sheet Public comment period. Granting the state to option out the federal supervision requirement for CRNAs. Key points. The federal supervision requirement mandates the CRNA have to supervised by the physician when administering anesthesia in the context of medical reimbursement. The option to option out allowing the CRNA to practice without direct physician supervision while still being reimbursed by the Medicare. Cost effectiveness and savings of the healthcare savings and patient making anesthesia more sustainable and affordable within the Center for Medicare and Medicaid. Actions Legislation had included no discrimination provision to prohibit the healthcare plan from discriminating against qualified licensed healthcare professions such as CRNA and other non-physician providers solely based on their licensure. Acknowledging the CRNA possesses the necessary education, training, and experience to provide safe and effective anesthesia care without physician supervision. Attenuating the option of states citing the increased access to the anesthesia care as primary rationale for their decision. Emphasizing the option out is the best interest of the state's citizens.
Letter of support. To Ron DeSantis, Governor of Florida, the Florida International University's Doctor of Nursing Practice Nurse Anesthesia program is imploring you to opt out of the federal supervision requirement for certified registered nurse anesthetists. As you know, currently, certified registered nurse anesthetists require physician supervision. However, in 2001, the Center of Medicare and Medicaid Services allows states to choose to be exempted from that ruling. As the governor, all you would need to do is send a letter to CMS attesting for this. During the pandemic, regulations were relaxed to help with the strain on hospital systems. During that time, CRNAs were able to prove the value of allowing CRNAs to opt out. As anesthesia care grows, it is becoming more difficult to recruit and retain physicians. Opt out would benefit the state by providing cost effectiveness and increasing access to healthcare in underserved communities, ultimately improving public health outcomes and health equality. CRNAs can help cost effectiveness and savings allow anesthesia to be more affordable within CMS. By opting out, anesthesia can become timelier and streamlined, reducing the wait for patients and improving patient outcomes. CRNAs are the most cost-effective option when eliminating the need for physician supervision. Research shows that CRNAs provide equally safe care and patient care is never compromised. Sincerely, FANA Panther.
Frequently asked questions. What is a CRNA? CRNA are certified registered nurse anesthetists who are advanced practice nurses specializing in anesthesia school. CRNAs are able to provide anesthesia in a variety of settings, from hospital, outpatient clinics, dental offices, across mission trips, abroad, and are major providers in rural areas across the U.S. What is the difference between an anesthesiologist and a CRNA? Is one better than the other? Anesthesiologists are trained physicians specialized in anesthesia after medical school, whereas CRNAs are advanced practice nurses who were intensive care unit nurses who underwent anesthesia training for 3 years. Both are more than qualified to provide anesthesia as they must complete minimum requirement of hours and meet criteria in X amount of cases. Both anesthesiologists and CRNAs must meet the same required amount of cases and hours. Research concludes that there is no difference in quality of care or patient outcomes if anesthesia is provided by CRNA or an anesthesiologist, as the goal is to provide excellent patient care. What is an opt-out? What is Florida considered as? Opt-out is the term used by CMS to allow states to opt out of federal supervision requirements for CRNAs. That is saying in an opt-in state, physicians, any kind of physician is able to supervise a CRNA in providing anesthesia care that is approved by that facility. Opt-out states allow CRNAs to practice independently without medical supervision, such as being overseen by any type of physician. It could be any physician that even is not specialized in anesthesia. Florida is not considered an opt-out state, so CRNAs must provide anesthesia under a licensed physician approved by the facility under which the CRNA is working for or with. How are you affected? Florida, as an opt-out state, will allow an increase in anesthesia care due to an increase in anesthesia providers that could work alongside each other instead of a medical supervision or in a care team act, care model act. That is, patients would be able to get increased provided care without going through a series of CRNA and anesthesiologist or physician, whereas in opt-out state, CRNAs and anesthesiologists are able to work side by side, assist and help each other out for their patients. What is the overall effect of being an opt-out state? Opt-out would benefit the state by providing cost effectiveness and increasing access to healthcare in underserved communities, ultimately improving public health outcomes and health equity. CRNAs can help cost effectiveness and savings, allowing anesthesia to be more affordable within CMS. By opting out, anesthesia can become timelier and streamlined, reducing the wait for patients and improving patient outcomes. CRNAs are cost effective when eliminating the need for physician supervision. Research shows that CRNAs provide equally safe care and patient care is never compromised. How can you help? If you could please send a letter to your state legislature to voice your support as Florida or in the current state that you're currently in to become an opt-out state. What is opt-out? What is Florida considered as, and how are you affected? Opt-out is a term used by CMS to allow states to opt out of Florida supervision requirements for CRNAs. Opt-out states allow CRNAs to practice independently without medical supervision, such as being overseen by any type of physician. Florida is not considered as an opt-out state, so CRNAs must provide anesthesia under a licensed physician approved by the facility under which the CRNA is working for or with. Most hospitals, Florida's most hospitals, they are medically supervised, so a physician anesthesiologist will oversee 4 CRNAs. How are you affected? Florida as an opt-out would allow an increase in anesthesia care due to anesthesiologists and CRNAs work alongside each other instead of being medically supervised.
Some additional frequently asked questions are, what is the overall effect of being an opt-out state? Opt-out would benefit the state by providing cost effectiveness and increasing access to healthcare in underserved communities, ultimately improving public health outcomes and health equity. CRNAs can help cost effectiveness and savings, allowing anesthesia to be more affordable within CMS. By opting out, anesthesia can become timelier and streamlined, reducing the wait for patients and improving patient outcomes. CRNAs are the most cost-effective option when eliminating the need for physician supervision. Research shows that CRNAs provide equally safe care and patient care is never compromised. Another question, how can you help? Send a letter to your state legislature to voice your support of Florida as an opt-out state.